Travis Robbins. For those of you that don't know me, I'm one of the owners of Robbins Rehabilitation, and I'm here to talk to you today about low back pain, sciatica, SI problems, a lot of different problems that we're starting to see in our clinic already around this time of year. So it's December and January, we're making low back and sciatica pain relief months. So we're doing lots of different things in our clinics to help our past patients out and people that haven't seen us before eliminate low back pain and hopefully try to prevent it in the holiday season. So we're already seeing a ton of people coming in that they hung lights on their tree or their house, they've got stuff in and out of the attic, they've gone out shopping and picked up heavy things like big TVs and already having back pain. So what we're going to try to do over the next 3 videos is give you information about how to prevent that from happening, hopefully, and if you're already having some problems, maybe help you treat that a little bit on your own. So, the number one thing that we see at our clinics, the number one cause of low back pain and sciatica is the inability to keep a neutral spine. So that might seem like a fancy term, but all it is really it's good posture. So if we have patients that come in and we say, what do you think is good posture? It's really hard for them to kind of put words or describe what that is. So I'm going to show you what that is right now. So I'll be interchangeably talking about good posture, neutral spine, neutral pelvis. All that is the same thing. It's basically keeping your spine where we want it to stay for as much of a period of time as possible while you're doing your stuff during the day. And a neutral spine, or good posture, whatever you want to call it, is if I take a pole, so in our clinics we use PVC pole. If I take a pole and I put it on your back, it should touch in 3 spots. It should touch in your tailbone, it should touch in your mid-back, or what we call the thoracic spine, and it should touch in the back of your head. And the space between your low back, or you can kind of consider like your belt line, where your belt would be, and the pole is the width of your hand. So it's a really easy thing to monitor on your own. Okay? So this is where your spine should be all the time. Okay? While you're standing, while you're sitting, while you're moving, no matter what you're doing, what I say to my patients is, I should be able to follow you around at home or work or wherever you're going, slap this pole on your back, and that's where your spine should be. The more time you spend in this position, the less you're going to have back pain, I promise you. You don't have to spend 100% of the time there, but being conscious about where your spine is during the day while you're doing activities is really important. I'm going to show you 2 ways right now that you can work on this at home. Okay? So the first thing we want to try to work on is a forward bend. So we typically use the end of a table to do this. So if I'm going to bend forward, I want to maintain this relationship of this pole on my spine. What we see a lot of is some people will kind of bend over and then they'll get that flexion out of their back and the pole comes off the tailbone. Right? And that's how you know that your spine is not in a good position. If I'm flexing forward in my back, I'm getting that motion in the lumbar spine segments, typically L4 and L5, where we see a majority of the problems, not from my hips, these huge ball and socket joints that are designed to take the brunt of forward trunk flexion. Right? So just simply getting a pole at home and just doing forward bends and maintaining that spinal relationship is something that we work on a ton in physical therapy and a ton we give for home exercise programs. So just maintaining that relationship. Right? Once you get good at that, the next thing that we do is move from sitting to standing, or standing to sitting, whichever way you want to do it. So from here, same thing. Now we're incorporating a little bit more of the knee joints. Okay? So we need to kind of get motion from the hip and the knee, so it's a little bit more complicated motion. So from here, what we're going to do is just move from standing to sitting, and then back up from sitting to standing. So here, what we tend to see a lot of problems with our patients is that will kick off of the thoracic spine or the mid-back because you're throwing your head back. So think about kind of tucking your chin down, maintaining the spinal alignment, and moving from sitting to standing. So what I tell my patients is, this is like brushing your teeth. Right? So this is something you have to practice and maintain in order to maintain a healthy spine. So I'm not asking you to do this for 30 minutes a day. Typically when patients come in, we say, start out doing this 5 minutes a day. 5 minutes in the morning, 5 minutes at night, around the time that you're brushing your teeth. If you can do that, then you can kind of maintain a neutral spine and you're going to have much less back pain in the holiday season. Thanks for watching the video. We're just going to wrap up here and let you know that there's going to be another video coming soon to your inbox that's going to talk about the second most popular reason why we see back pain and sciatica patients at this time of year, and we'll show you how to treat that on your own. And the other thing I want to let you know is if you have any questions about this, then just reply to this email. It's my personal email. You'll email me if you have specific questions about back pain, something that's bothering you. Then you can just ask me a question and I'll get right back to you as soon as I can. So thanks for watching. Stay tuned for videos 2 and 3, and we'll hope to see you soon.